Psychosis is the underlying problem with schizophrenia. Psychosis first, and then a decline in the person's function. And then over time, there's changes in their mental abilities. So psychosis has five basic things. The ones that everybody thinks of are hallucinations, where you're seeing things that aren't there, hearing things that aren't there. But it could be in any of the five senses, like feeling a touch when there's no one touching you. But it's most commonly seeing and hearing. The other is delusions, that's false beliefs. The fifth one is kind of odd. That's negative symptoms, which means they won't speak much, they won't have a facial expression, they don't want to interact with other people. And then the other two are disorganized thought and speech, and then disorganized behavior. So that fifth one in the middle, disorganized thought and speech. So in psychiatry, clinically, in the office and in the hospital, the best way we can tell what someone is thinking is by what they're saying. The other way, of course, is by their facial expression and their body language.
Yeah,
Because I had some patients who were mute; they didn't speak. Two that come to mind immediately: one older woman and one younger woman, and actually there was a third young man. He was my colleague's patient. Those three people, during their 4 weeks in the acute psychiatric hospital, they never said a word. They were completely mute. They have a fancy thing called word salad. It's where the person is talking, and they may be going like a regular rhythm and talking, but the sentence structure doesn't make any sense. So it's like the words are all jumbled up. Another thing is neologisms. It's called neologisms, and that's where the person makes up a new word. and it could be a word that no one else has ever heard before, and it could be mixing two words together. And it's not like a journalist or a PR advertising that's doing a cutesy thing. They're actually doing it as part of their illness, and they don't realize. And the other thing is using a word like green, the color green, but they don't mean the color green. They mean something else. So when they're speaking, they'll say that word, but they mean something totally different. The other thing is the syntax and the grammar of regular English or language or whatever, Spanish, whatever natural language. There's a certain grammar of the way people talk in their region or their little community. And so there's certain styles of talking. So the computer can analyze, well, so can the person, the doctor or the clinician, how their grammar is going. And their grammar could get all mixed up. Not like Yoda in Star Wars where they're talking like backwards grammar, but they'll jumble up the grammar. And that's a sign that their brain is not working properly.